Hello, and welcome to Elevation House's virtual clubhouse as we share the second episode of Mental Health Month Moment. Today, I, Carrie Edge, will be sharing with you some statistics about mental health just to bring light to the topic. We have taken national and state statistics and applied many of those specifically to our community here in Rome and Floyd County. So we hope that this is enlightening and educating as well. I want to bring awareness because we fear things that we don't understand. And so we felt like it was important for everyone to have a clearer picture of what mental health looks like in Rome and Floyd County. The first slide we will be sharing with you is just a little bit of information about the impact that Elevation House has had since June of 2019 when we opened our doors for the first time. This can be found on YouTube, but let's check it out right now.
My name is Hunter Duke, and today I'm telling my elevated story. My battle with mental illness started when I was very young. I was bullied a lot, viciously, and on top of that, I was molested for 2 years. All this kind of culminated when I was 15 years old. It was the first time I really hit a full-blown crisis episode. I thought about taking my life for the first time. Took me to a psychiatrist. They gave me an evaluation. I said basically the opposite of everything I was actually feeling because I was already bullied. I didn't want to be any more different. I didn't want to live with a mental illness. I really started gaining my power back when I got into treatment. For years, I lived in denial. I lived in denial of being molested. I lived in denial of living with mental illness. I lived in denial that I had these unique struggles. Finally accepted those things. I got my power back. I could stand prouder as who I am. I could find myself again. When we come through that door, we've all been hurt, we've all struggled, and in that, for the first time, I felt like I wasn't alone in how I felt. And I kind of stalled out until once I reached recovery because I didn't know where to go from there. I didn't know how to take the next step towards building a future for myself. And that's where Elevation House came in. I didn't know how to truly dream or set goals that were realistic and healthy for me. I didn't know how to plan. And for the first time in 3 years, I'm able to see a path towards building a future to my dream.
My name is Glenda Michelle Dixon. I prefer to be called Michelle. A little bit about me. I am 51 years old. I have dual diagnosis, meaning that I have an addiction along with mental health illness. I live with bipolar, post-traumatic stress disorder, and psychotic features. I've made a lot of bad choices. I went down the wrong road that have led me to incarcerations. That has caused me to not only alienate myself, but alienate me from my family, from my children. I lived a life of isolation. I felt hopeless. I felt like that there was no reason for me to even live. I felt that I was alone. I felt that there was no purpose for me here on earth. I felt like even though I love God, I felt like He even abandoned me. And I was in a very, very dark place in my life to where I just didn't feel like there was no other option for me but to commit suicide. And I went to a program called Next Door, and Next Door introduced me to a program called Elevation House. And when I first came to the Elevation House, I didn't know what to expect. But all I know is when I first walked in the door, I felt a sense of peace. When I met Miss Carrie here at the Elevation House, it's like she gave me a warming feeling, her and Mr. Dunn, and it was just a sense of peace, like I said, and they made me feel loved. They made me feel welcome. The peers here made me feel loved and welcome. I don't feel stereotyped here. I don't feel different here. I feel like I'm just a part of the team. I come here with a purpose. You know, since I've been here, my confidence level have built up. Out there in the world, it's very chaotic. And sometimes I just need to get away. And when I come here to Elevation House, it's my outing because I have family here. You know, it's something when you can come somewhere and you meet people that's just like you, that have conditions just like you, and you're not stereotyped, you're not made different. You don't have to worry about isolating, you don't have to worry about hiding, you don't have to worry about trying to be something that you're not. You can just be yourself. You know what I'm saying? And that's what I want to be. I just want to be myself. I want to be the unique person that God created me to be. That's what I love about Elevation House. It's just a different place. It's a place that's like no other. It's not a treatment facility. It's not or anything like that. It's just a place where I can just really call home.
Yeah, a place that you can call home. I think we all need a place like that, don't we? Wanted to share that because we need to put a face to the numbers sometimes, right? We can just look at numbers all we want, but numbers have faces. And these are the faces of mental health that we will continue to show you, faces of our members who bravely share their stories. But behind those stories are these statistics that I'm going to share with you. And I think it's also important to look at the brevity of what we are talking about when we talk about the state of mental health. So let's look at mental illness by the numbers. Most of these statistics were pulled from Mental Health America, as well as NAMI, the National Alliance of Mental Illness. And so you can go back and look at their websites and pull down a lot of that information. But again, all of these statistics have been made localized as much as we could for Rome and Floyd County, using national and state statistics and applying them to our population. So many of us have heard the 1 in 5 statistic. 1 in 5 US adults will experience a mental health condition sometime within a 365-day period of time. And so in the United States, there are 256 million adults, and so that translates into 51.2 million Americans that will experience a mental health condition within a year. Floyd County, 15,170, and then Rome, the city of Rome, 5,495 adults will experience a mental health condition in 365 days. More specifically, we talk about serious mental illness. Elevation House specifically works with adults that experience serious mental illness or live with serious mental illness. And when we say serious mental illness, or you see SMI, what we're talking about is mental or emotional disorder that seriously impairs the functioning and substantially interferes or blocks or limits one or more major life activities. It is chronic mental illness. And so 10.24 million adults in America will experience a chronic, debilitating, serious mental illness 3,040 in Floyd County, and 1,100 in Rome, Georgia. Again, digging a little bit deeper, depression is the leading cause of disability. Oops, let's go back. Depression is the leading cause of disability worldwide. Depression and anxiety cost our global economy $1 trillion a year in lost productivity. And more than 10 million adults have an unmet mental health treatment need. And that specific number has not declined since 2011. What happened in 2011? Mark that year in your mind. 45% of adults are inadequately insured. All of these things combined together result in some common mental illnesses that we experience, that people experience over a 12-month prevalence. So the highest one is an anxiety disorder at 19%. Followed by depression at 7%, dual diagnosis, which was mentioned by Michelle. Elevation House, in conjunction with Living Proof Recovery, as funded by the Community Foundation for Greater Rome, provides a program called Root. It is one of a kind in our community, and it specifically looks at combating dual diagnosis, which we see here as the number 3rd, or in tying with post-traumatic stress disorder. So this is a mental illness coupled with a substance abuse disorder. And so we have a holistic program that we use to fight that. Then number 5 here on the list, that 3% is bipolar disorder, followed by obsessive compulsive disorder, and last but not least, schizophrenia. When we look at subsets or subgroups of our population, those most at risk, at the top of this list to the very bottom of this list, these are the groups that are considered at most risk. So you have 37% of lesbian, gay, and bisexuals who experience a prevalence of a mental illness over 12 months period of time, 27% mixed race or multiracial, 22% American Indian and Alaskan Native, 20% whites, 17% Hispanic, and 16% Black, and 15% Asian. So as we just break down into subgroups and the prevalence of mental illness over 12 months, that's what it looks like. Next, I know we service adults at Elevation House, but adults become grown-ups, right? And we're working in the community in ways of helping to bridge the gap for those young people who are leaving the school systems at 18 to 21 years of age, when they age out of the system, to having a bridge for them so that they're aware that Elevation House is there for them to make the process smoother for them to continue to pursue their dreams. And so we'd be foolish not to look at mental health of our youth. 17% of youth in the United States will experience a mental health condition. And that equates to 12.24 million youth. Those are children 18 years of age or under. In Floyd County, that equates to 3,850, and in the city of Rome, 1,560 youth. So major depression has increased in our youth by 4.35% over the last 5 years. Over 2 million youth, and this is in the United States, have depression with severe impairment. There have been increased issues with youth and mental illness since spiking at 2011. Remember, I said to remember that date. So this indicates that where there was some type of cultural shift that was created, that created a mental health crisis for our young people. And I would say it's the post 9/11 experience and what our children experienced at that time. Over 70% of youth with major depression are in need of treatment. And that's really so sad. 70% are in need of treatment. That means only 30% are actually receiving appropriate treatment. And to further exacerbate that, our school systems in the state of Georgia show that less than 1% of students are identified with an emotional disturbance that would allow them to access the aids and supports that they need within the schools, and the adaptations that they need through special education services to be properly supported. So not only are they not receiving treatments outside of the school system, but they're also not receiving accommodations to help them with their education. So speaking of youth and education, the state of Georgia has a program called APEX. It's a partner between community-based mental health services, the local school districts, and support from the Department of Behavioral Health and Developmental Disabilities, or DBHDD. These programs help to address the mental health needs of students in the state of Georgia. And there are I think there are over 500 school systems that are engaged in this program. And you can see that there has been a huge increase, in fact, a 259% increase in students over the last 4 years who are receiving services for mental health through the APEX program. The community-based partners that I mentioned noted that 52% of all the referrals were for a demonstration of symptoms that look like depression. And so these are reported out by teachers, school counselors, et cetera, to these providers, noting that our children seem to have depression or exhibiting symptoms of depression. Providers identified these 3 things as the top diagnoses of the youth that they were serving. 38% had some type of disruptive, impulsive, or conduct disorder. 30% had a depressive disorder, and 9% lived with some type of trauma or stress-related disorder. Unfortunately, and how sad is this, mental illness, and this is a strong statement to swallow, but mental illness is a killer. Suicide is the second leading cause of the young people and young adults in the United States of America between the ages of 10 and 34. Second leading cause of death. It just shouldn't be. And suicide overall is the 10th leading cause of death. 31% increase in the suicide rate since 2001. We've seen 46% of people die by suicide. They have a mental health diagnosis, but 90% of people who die by suicide have had some type of symptom of a mental health condition. And so that tells me that there is still stigma in our community. There is still fear of coming forth with a symptom of a mental illness or a mental health condition or crisis. And people do not feel comfortable and supported enough to come forth. And so that's how we have to combat this killer called suicide. It's with eliminating and erasing the stigma associated with mental illness. 4% of all the people around you that you know have some type of serious thought of suicide, serious ideations about suicide. So in addition to the subsets that I shared before, what are the most high-risk populations, but specifically when we look at suicide? Number 1, 70% of all people who die by suicide are males. Lesbian, gay, and bisexual youth are 4 times more likely to attempt suicide. And transgendered people are 12 times more likely to attempt suicide. Looking specifically at the state of Georgia, Georgia ranks 36 out of 51 for a high prevalence of mental illness, yet a low rate of access of care for both adults and youth. So we have a higher rate of mental illness in our state and a lower rate of access of care. And so we need to even the playing field. Specifically breaking that down for adults and for youth, 41 out of 51 for adults. So there's a big difference between the care for adults in our state and the care for youth in our state, because we are ranked 23 out of 51 for youth. I look specifically at some health needs assessments. Floyd Medical Center in 2019 completed a community health needs assessment, and they indicated that mental health was one of the 4 pervasive community health needs. The next bullet point is a statement that's taken directly from that assessment, which also can be found online, and it says access to care, cardiovascular disease, mental health services, and nutrition were seen as significant concerns that affect many residents. And we're talking about pretty much the 4-county radius that Floyd Medical Center services. Also in that assessment, it was noted that in 2017, Floyd Medical Center could identify 118 local providers for mental health services, or local providers for mental health services can also be referred to as QMHPs, or qualified mental health professionals. According to this particular document, we have 1 QMHP for every 830 people in our county. Talk about overload. 11% fewer qualified mental health professionals per 1,000 people than just your regular primary care provider. So there is a shortage of qualified mental health professionals within our community, as many or all communities in the United States of America. Very underserved field. So we know that there's a huge impact on our community when we talk about mental health and untreated mental health, and when we talk about there not being enough resources for mental health. So what's the social impact? And these 5 clouds here show a little bit about what happens when mental illness is not properly resourced in communities. And we have addiction, incarcerations, poverty, suicide, and homelessness. So specifically looking at the impact, starting first on the person level, the person perspective, how does it impact an individual living with mental illness? Number 1, there's an increase for chronic disease and diabetes and cancer for someone who is diagnosed with a mental illness. Individuals diagnosed with mental illnesses are also twice as likely to have a cardiometabolic disease. That's something like diabetes, heart disease, or a stroke. And 19% of US adults with mental illnesses also have a substance abuse disorder, or dual diagnosis, as we have referred to it before. From the family perspective, the impact on the family is that 8.4 million Americans provide care to an adult with an emotional or mental illness. My family is one of those families, as my son lives with a spectrum disorder, a bipolar disorder, and generalized anxiety disorder. Caregivers like myself spend an average of 32 hours per week providing unpaid care. That means many times that compromises the livelihood of a family or a family unit, because someone has to provide care at an average of 32 hours for their loved one living with an emotional disorder or a mental illness. So getting macro now, we're looking at the community impact. So specifically Rome and Floyd County, the cost of psychiatric care in Rome and Floyd County is $89.9 million. This is an estimate based off of national statistics. Statistics also show that your average hospitalization cost is $2,500 a day. What a tremendous impact that has in our community, especially when we noted that nearly half of our adults in the United States are uninsured or underinsured. The average psychiatric hospital stay is 11 days. And so that rounds up to an average cost for a stay is $27,500. What kind of impact does that have on you as a person, if that's you needing psychiatric hospitalization? What kind of impact does that have on a family? And furthermore, a community when so many people are under or uninsured? $27,500. 1 in 8 of all visits to emergency room in the United States are related to a mental illness or a substance use disorder. And so based off of Floyd Medical Center ER numbers in 2018, that would have been 12,740 visits to our local ER, or at least one of our local ERs. 78% of adults living with serious mental illness are unemployed, while half desire to work. And so you look at the burden of unemployment as well, and the stressors and strains that come along with that. That's why Elevation House works so hard to help people who want to be employed, who can be employed, find jobs that work for them. 20% of people experiencing homelessness also have a serious mental illness. And so there are some cogs in this wheel of mental illness that are connected, that you have to treat every symptom and treat it holistically to solve the community, the impact that it has on the community. Community impact going forward a little bit more, digging a little bit deeper. 37% of people incarcerated in state and federal prisons have a diagnosed mental condition. And when you look at it on a state level, the state spends almost 40% more to house an inmate with a diagnosis than they do for those without a diagnosis. Yet they only spend about 6% of that same cost annually if the person is not incarcerated. And so the disparity between those two numbers is drastic. So let's say it's $100,000, which that's pretty close to what it costs to house an inmate with mental health diagnosis. They would only spend $6,000 annually if that person was not incarcerated on their mental health. That shouldn't be. Floyd County just recently passed a $2.2 million SPLOST to add on to the medical facility, improve the medical facilities at our local jail to add 15 mental health beds, $2.2 million of special purpose sales tax that's going to build a facility in our jail. 70% of youth in our juvenile justice system have at least one mental health condition. And all of these, we could talk more in depth about the impact and whether or not resources are being put in the proper place to really resolve and provide some relief for mental health in our communities. So to combat the impact that mental health has on our community, there are a number of resources. They are few, but they are here in our community. We are fortunate to have these resources, and they can be found at the United Way of Rome and Floyd County's website, which is listed up there, www.uwrome.org. And I believe on the third page of that resource, and you won't really be able to see this, is a list of the mental health and counseling and suicide prevention services that are provided in our community. So if you need those, they are here. And many times, many of the organizations like Elevation House included can also help connect you with other resources that may not be listed, or connect you with collaborations that, again, support the whole person and all of the needs that one might have. So that's just mental health by the numbers. Hopefully this gives you a better picture of what we're talking about when we talk about the state of mental health in our community and in our nation. And just think a little bit deeper about some of these statistics and the impact that it potentially could have. I want to thank you all so much. This was a little bit drier than norm, but I wanted to thank you. I want to thank you for staying with us today and learning more about mental health, because as we learn more, we can do more and we can put resources to work for us in our community. So thank you so much for watching this Mental Health Month moment. I will be coming to you with episode 3 next week. Thank you again. We will see you